New numbers pointing to a brighter picture in the battle against the coronavirus pandemic in the U.S. The network's Christopher Gomez is in the control center with more on the predicted decrease.
The national rate of new COVID-19 infections and hospitalizations are declining. And while some experts are making bold predictions about this Delta wave ending by Thanksgiving, others like Dr. Anthony Fauci are more cautiously optimistic. Average new infections dropping and hospitalizations declining. Positive progress that has some experts predicting the worst of COVID's Delta-fueled summer surge may be behind us.
If I was trying to put an endpoint on when this Delta wave kind of has moved through the country, it's probably Thanksgiving. We're going to have hopefully a vaccine available for children. And at some point before the end of the year, we probably will have the orally available drug from Merck if things go well.
The latest data from Johns Hopkins University showing the U.S. averaged nearly 96,000 new cases a day over a week ending Friday. That's a 44% drop from a Delta-driven peak average in mid-September. But some experts point out that the numbers are still high.
We have to just be careful that we don't prematurely declare victory in many respects. We still have around 68 million people who are eligible to be vaccinated that have not yet gotten vaccinated.
Meanwhile, the national number of people battling the virus in the hospital is more than 67,000 as of Friday. According to the U.S. Department of Health and Human Services, that's a 35% drop from last month. But some parts of the country are still struggling. One doctor in Michigan says his hospital is overwhelmed with COVID-19 patients.
I had 6-7 people sitting in the emergency department waiting for beds at other hospitals that didn't exist, waiting for ambulances that were, 6-7 hours away from being able to bring them to those places.
And breaking this morning, the pharmaceutical company Merck has requested FDA approval for its COVID antiviral. Merck says the treatment can reduce the risk of hospitalization or death from COVID by over 50%. Reporting live in the control center, Christopher Gomez, South Florida Media Network.